Welcome to Healthy Focus, the Duke Raleigh Hospital Community Education Series.
Please join me in welcoming Dr. Kevin Speer.
Thank you, Mandy, and welcome. I'm glad everybody can come out tonight. We're going to talk about the shoulder, and as you can see by the title slide, it's different than the advertised talk. I thought living with the aging shoulder was a little bit dull after we sort of put it together, so we sparked it up a little bit. But I'm not being facetious about what a happy shoulder is. I'll keep returning to that theme this evening. But what is a happy shoulder? And I'm not really talking about some pop psychology notion or concept, but a real approach or understanding of the shoulder to help you sort of deal with the aches and pains that come as we all get older. So maybe one way to define what I say is a happy shoulder is, well, what it's not. And this is obviously not a happy shoulder. It's a painful shoulder. But from my perspective, this is not a happy shoulder either. I mean, a happy shoulder is not a shoulder in the abstract in which you would say, well, it's some shoulder that you can lift a certain amount of weights and do a certain amount of things. I don't think of shoulders in those terms. I think a happy shoulder is a shoulder that, for you individually, functions without limitations that you would otherwise impose. Meaning, whatever you want to do, your shoulder is allowing you to do. And everyone's different. Everyone has different goals, different objectives. And so what's a happy shoulder for one person might not be a happy shoulder for another person. The question is, how do you get a happy shoulder? And that's really what the talk is about tonight, that I want to discuss with you. And you're going to see some themes of these three interrogatives, the what, how, and why. But think in terms of how do you get a happy shoulder is understanding what makes the shoulder hurt. What's the problem of the shoulder? Why does it hurt? How are you going to make the shoulder not hurt? Or gleaning some insight into why it's important to do what's required to make the shoulder happy, make the shoulder not hurt. And then why have you decided that this is so very important? Ultimately, I think the talk's going to go towards this inspiration. How do you figure out why it's important? I've borrowed this interrogative series of why, how, and what from a book by Simon Sinek. He's talked about the golden circle, and the book he wrote is called Start With Why, and it's subtitled How Great Leaders Inspire Everyone to Take Action. And I had read it, and it said, well, this is what I'm doing with patients. Because much of what clinicians, I'm an orthopedic surgeon, do, yes, we diagnose, we treat, we intervene, we recommend certain treatments, but much of it is we encourage, we coach. I'm a cheerleader. I'm trying to encourage you to do things that I know if you did them, they would help, but they're always not so easy to do. And this is part of what Simon Sinek was talking about. And in his book, this golden circle of why being in the middle here is if you can determine the why of what you're trying to do, why you're trying to do it, that's the inspiring component. That's the inspiration. I mean, you can figure out the what it is. That's more of an intellectual effort. And for orthopedic purposes, it's the diagnosis. That's intellectual. This is the problem. It's a diagnosis. Or the how of it, meaning how to get it better. That's mechanics. That's rehab. That's things to do. But why you do it, and what inspires you to do it, and what keeps you doing it, therein lies the challenge. Because inspiration is essential to create a happy shoulder. And the reason is that the shoulder degenerates and ages as we get older. It's like graying of hair. It's called a senescent change. So as we get older, the shoulder changes. Not from injury, it could, or not from wear and tear per se, or it could. It just changes. And as the shoulder changes, things that used to be accomplished easily are not so easy. Doesn't mean they're not still accomplishable, but it takes an insight and an inspiration to keep doing them. So what happens to the shoulder as we all get older? Bone spurs form, calcium deposits form, tendons, which connect muscles to bone, deteriorate and soften and can tear. By age of 70, the data is anywhere 20 to 30% of people have torn tendons in their shoulder at age 70. Why? It's because they're not 20 anymore. And it's not because they've injured it per se. Cartilages in the joint soften. That's more germane to like the knee and the lower extremity. Muscles weaken. It's true. We lose our hormones change as we get older, and some of those hormones are integral to the maintenance of muscle size, to trophicity. And bones soften as we get older. Softening bones and osteoporosis, that has nothing to do with shoulder pain. But that is an age-related phenomenon. Before I go much further, I want you to indulge me about 3 minutes of shoulder anatomy lesson, because we're going to be talking about why the shoulder hurts, where it hurts, and things that hurt. But I want to be sure you have some insight as to how the shoulder is made. So the shoulder has 2 layers of muscles. So if you look at somebody in their bathing suit, and what you're observing is the outer layer of muscles. So from the front is the deltoid, the pectoralis muscle. From the back, here on the right, that's the trapezius and the latissimus muscle. These are the power muscles. These are the muscles that make the shoulder move, power, work, effort. But the shoulder is unique in the body. It has a second layer of deep muscles. That makes the shoulder rather unique. And that's called the rotator cuff. And that's where most of the mischief arises in people as they get older. Now the rotator cuff covers the inside of the joint. So here's the inside of a shoulder joint. So here's the humeral head, that's a ball, and the socket, that's the shoulder blade, called a scapula. And then there's muscles in the front, the top, and the back. Together, they form this hood. It's called the rotator cuff. Now inside the shoulder, everything is tightly packed. I analogize it to patients as it's like the piston engine in a car. There's no extra room for any stuff in there. And anywhere in the human body in which things are tightly packed but have to move, the shoulder has more motion than any other joint in the body. So for the shoulder to move fully and normally without friction, you need special gliding pads in there. Those are called bursa. Think of a bursa as a little balloon with some Vaseline in it. It's a little slick pad that allows things to slide past one another. And we'll be coming back to bursa, because therein lies where a lot of the problems in the shoulder are as we get older. So what makes the aging shoulder hurt? Well, things occur in the shoulder. We talked about bone spurs forming. So here's a cartoon of a normal shoulder. Here's the humerus, the ball, the sockets in there. These white things are the tendons, the red is the muscle. There's a bone over the top called the acromion bone. This little balloon here is depicted as a bursa. And so imagine that you go to the right here, a bone spur forms. It irritates the bursa. The bursa is inflamed. That hurts. Yeah, it definitely hurts, the bursa. So bursa is a source of pain. The bone spur in and of itself, because we all get them as we get older, all of us, aren't painful. Your bone spur causes pain if it irritates something. And what generally irritates in the shoulder is the bursa or the tendon, and the rotator cuff tendon can tear. Now, other areas of the body get spurs, most notably the neck and the back. So in your cervical spine, you get spurs. Now, everyone gets them. I think by age of 40, most everyone has an abnormal MRI already. This is in the neck. But in the neck, when spurs misbehave, they don't pinch tendons because that's not the way God made the neck. In the neck, spurs pinch nerves, and you get nerve pain. So it's still a spur problem, but it pinches something different. So the shoulder hurts because it becomes inflamed. Inflammation is the medium through which pain is recognized in the shoulder. I mean, the bursa can be inflamed, bursitis, tendons can be inflamed to some extent, tendinitis. The joint can be inflamed, a synovitis, a joint inflammation, or arthritis, when the joint's actually being is deteriorating and losing cartilage. But the main pain generated in the shoulder is the bursa. And again, so the bursa is here on the top of the shoulder. And when that bursa gets inflamed, it can ache. And it can ache a lot. And the way that we're wired up, the brain gets a bit tricked. And I'll show you on my right shoulder. So the pain, the bursa's here, and that's where the pain's originating. But in some people, the way the brain perceives it, you'll say, no, it hurts down here, or it hurts here, or and many times, well, I know it hurts there, and it might even be a little tender there, but that's not where the pathology is. And in some patients, I'll actually put my hands, and look, under my hand, that's not where the problem is. I know it hurts there. I said, and it's very analogous to someone who has a herniated disc in their back or a pinched nerve in their back, and they complain about buttock pain. To know it's your back. No, it's not my back. It's right here in my butt. No, it's your back. And at some point, they have to, now for other doctors, other orthopedic surgeons, that can be tough. Well, is it the hip or the back causing the buttock pain? But referred pain in the shoulder, because the shoulder refers pain, the neck refers pain, the back refers pain. Other areas of the body don't really refer pain, generally. If your wrist has a problem, you hurt in the wrist. If your elbow has a problem, you generally hurt in the elbow. So what will make the shoulder hurt? This is one of the secrets within the shoulder, and it's a simple concept, but it's so true. Think of the shoulder as a supply and demand. It's, economics 101. The shoulder has a certain capacity to work, to do stuff, that's the supply. You have a certain desire and need to do stuff, that's the demand. If the supply exceeds the demand, the shoulder's going to do it, the shoulder's going to function, and the shoulder's going to be all right. If your demand exceeds the supply, the shoulder might do it for a while, but at some point, it's going to wither. It's going to become irritated. It's going to hurt to some extent. And the result is pain and discomfort. So, dealing with shoulder pain, there are some simple solutions. Now, and I always like to start with simple and work my way from there. The simple solutions, now, these are simple solutions. They may not be satisfying solutions. They may not be good solutions, but they're simple solutions because their simple solutions are decreasing the demand. If you have a certain amount of supply and your demand is too high, you lower the demand, it's just that simple. Now my shoulder doesn't hurt. Why? Because I'm doing less. I didn't say that might be an enjoyable solution, but it's a simple one. And another simple solution is just to treat the symptoms. So decreasing the demands is pretty obvious. You can moderate your activities, modify your activities. I put this picture up because this is a good example of, as we get older, we get bone spurs form, as I said, when people want to sort of exercise their chest and they want to do push-ups. They, push-ups. That's really, it's rough on the shoulder because you load the rotator cuff. Say, yeah, but what can I do? Well, find a machine, a sitting press machine with the hands down here is much better. It works the chest just as well, but it doesn't provoke the shoulder like the push-ups. What's the difference? Is that you've just worked out an alternative way to exercise something that used to hurt. Generally, I tell patients follow the credo activities as pain permits. The shoulder is going to announce to you it doesn't like something if it doesn't like something. It's not going to be subtle. If it hurts, if you're doing something that is irritating the shoulder, you're going to feel it. Treating the shoulder symptoms is another simple solution. Again, pain in the shoulder is mediated through inflammation, most commonly bursitis. It's an inflammatory problem. Treat it with an anti-inflammatory medicine. Sometimes it's just that simple. Over-the-counter stuff, very good. Aleve and Advil. Of the two, I think Aleve works, is my preference, only because if you're needful of something for a week or two, Aleve you take twice a day and it satisfies a 24-hour need. Advil or ibuprofen you got to take 3 times a day. But they both work fine. It's just that trying to get people to remember three times a day medicines. And the problem with these medicines is heartburn and stomach upset. So after breakfast, after dinner, pretty straightforward. Midday, the idea that, well, I don't have time for lunch or I didn't eat lunch today, I'm going to take a full ibuprofen dose at midday with no food on your stomach, that's a bad idea. Other simple strategies, cold therapy. Bag of frozen peas, ice bag. The cold works wonderfully in the shoulder as a way to ameliorate pain and control discomfort. Don't ever forget that. It doesn't have to be super fancy. A bag of frozen peas works great because this is like a little bean bag. Have you ever used it? 2-pound bag, put it in the freezer, take it out, punch it once or twice, mold it around the shoulder. Because the problem you can't really put ice on the shoulder, or at least you should never put ice on the skin because you will injure the skin. So how do you know how long to put it? Well, you can put it over a t-shirt or on 15 minutes and off, or you put a bag of frozen peas on, and just about the time it starts to get cold enough that you have to worry about taking it off, it thaws. So it's simpler. Simple is always better. Another way of treating symptoms is cortisone shots. Now this, you have to see a physician or some provider for this, but cortisone shots, they're not curative. Basically a severe bursitis that's bad enough that you need a rescue, you put cortisone in the bursa and it just makes all the bursitis kind of recede. But again, bursitis is caused by something. And whatever that something is persists, or if it recurs, or if it comes back, likely the bursitis is going to come back. But cortisone has a role as a rescue when medicines fail. I don't want to leave medicines without talking about nutrition. I think that, again, inflammation of the shoulder is a problem, inflammation of the spine is a problem. Pain as we get older is all mediated through some inflammatory cycle. Bursitis, synovitis, arthritis. So if your body is naturally anti-inflammation, meaning you have a high antioxidant diet, that helps. Supplements can really help. Best one, omega-3 fatty acids, fish oils. It's great stuff. That's what the fish oils do. Vitamin C is an antioxidant. There's a lot of things you can eat. I mean, a lot of pills you can take in terms of pecans and walnuts and blueberries and things like that. That's in your handout. But in general, a more healthful diet is critical for some people who just can't seem to stop all the ache and discomfort in spite of exercise and treatment otherwise. So we've talked about the what. What is making the shoulder hurt? Now let's move one further ring in to the how. How to get the shoulder better. And basically, we talked earlier that the shoulder pain becomes a supply and demand issue. So at some point, you can decrease the demand, treat the symptoms, but the how to get it better is you got to increase the supply. You got to make the shoulder better. Make the shoulder better. Actually improve the shoulder itself. And the 3 pillars of shoulder improvement are improving motion, improving strength, and improving anatomy. Motion is critical. The shoulder has more motion than any other joint in the human body. And that motion is, we are designed to have that much motion. That's the way God made us, which means all of a sudden if you lose a little in-range motion or have a little tightness, your shoulder will not function as normally. And the problem isn't that, oh, I got a spur, or I got this, or I got that. The problem is you got a little stiffness. You have some adhesions. You have some scar tissue. And stretching is very important. And in the shoulder, what typically tightens as you get older, just naturally, the back of the shoulder. The back of the shoulder tightens. The posterior capsule becomes a little bit tight. It's a little bit analogous to people who have back issues. The hamstrings get tight. It's just their tendency. And people who learn this and manage this and learn to address this, sometimes that's a very simple solution to keeping their shoulder functioning nicely. Strengthening the shoulder is key. You got 2 layers of muscles. And the inner layer, the rotator cuff, is where the mischief arises in the shoulder, and it's where you got to keep the shoulder stronger. And this is not, the gym work, weight work, and all that. That's more the muscle that you visibly see. The deep layer of muscles, the rotator cuff, strengthen those is simple, but it's with little weights and high repetitions. And you can do it on your own or with someone to assist you. I think there's great value in working with a shoulder exercise educator. Now, I use that generic term because that could be a physical therapist, it could be a chiropractor, it could be a personal trainer, it could be an occupational therapist, someone who understands how to do these things, who can educate you. Because it's not rocket science, but it's not intuitively simple for most people. Meaning, so here's an example of a physical therapist working with this gentleman. Put his hand here. He's doing a stretch out the back of his shoulder, where most people tend to get tight, and that tightness leads to the shoulder getting more bursitis. Once the therapist does that, and you can teach somebody, here's a stretch on how to do it. Now he's been taught how to do this, so the elbow is here. It's not there. It's not there. Just little stuff. And sometimes getting educational brochures and all that are helpful, but I'm more of an advocate of having someone show you, and once you know how to do it, then you can do it. Same with strengthening. Where do you hold your arms? How do you, your angles? Little stuff makes a difference in the shoulder. And once you know how to do it, it's simple. But if you're going to do it, you might as well bother to do it right. Water exercise is very helpful. Now this is for shoulders that are more infirm, shoulders that are more delicate, shoulders that are more problematic. Because in water, the arm weighs 1/8 of what it does on dry land. So water therapy is a tremendously adjunctive regimen for shoulder rehab and shoulder effort. And I especially have begun now in the last month and well through the summer, tell patients, take advantage of the summer. Especially if you have a really painful shoulder and exercising is hard, you're just trying to recover a shoulder from something, don't forget the value of the water. It can really help shoulders. So the 3 pillars of improving the shoulder: improve motion, improve strength, we talked about, and finally improve anatomy. Now, improving anatomy, the expression of that, the obvious expression of that, that's surgery. And sometimes it comes to surgery because tendon tears are inert. They don't heal on their own. And bone spurs don't go away on their own. The rationale for some patients for surgery is that, they have interfering pain. They've endeavored to get it better through a variety of means. And at some point, they're unwilling to deal with the shoulder as it is, and they need their anatomy improved. Either bone spur removed, or the bursa excised, or their adhesions removed, or the tendons fixed, or some combination thereof. And all that is what surgery is designed to do: correct the things that are structurally wrong. Approach the shoulder as a mechanical unit. Now, the rationale for scheduling of surgery, really, in my experience, is patients seek relief from pain at night. It's night pain. So again, we sort of moved from the remedies for the shoulder and how to get it better, that you're having some persistent interfering pain, and you're seeking other options. And the question is, what motivates you to seek another option? Generally, what motivates people to seek options, to see an orthopedic surgeon, they got pain at night, and they want relief from that. And it's got to be at least once a month, and all the cascade of things that physicians are pelted with on the internet about new research here, new research there. It's about the value of sleep as you get older. It's a long list of you've got to maintain your sleep-wake cycle for healthfulness. So surgery, so pain at night is central to the rationale. And I just want to talk about this for a moment, because I think a lot of people have confusions or questions about pain at night. And so I'm going to take a little sidebar here to talk about pain at night. But why does the shoulder hurt at night? Well, there's three considerations. One is you have overwhelming pathology, meaning this is not something that's going to get better with medicines and activity moderation and simple things I've talked about earlier. That could be a large rotator cuff tear, or arthritis, or God forbid you have cancer or something like that. More commonly, what hurts a patient at night is the way they sleep. They roll on the shoulder. That's a problem. So if you have someone who, most of us are fairly habitual on how we sleep. God knows I am. I sleep on my right shoulder. Unfortunately, my right shoulder doesn't bother me. But if it did, that'd be a problem for me. I mean, I have to adjust, and a lot of patients find it very difficult to adjust. And laying flat while you sleep, that hurts the shoulder. And the reason is, think of bursitis as swelling. That's not visible swelling, but just imagine it like swelling. So if you hurt your ankle and it was swollen, you look down and say, oh, it looks swollen, and it's pounding, it's aching. People intuitively, most people understand, get off your feet, get your foot above your heart, and it feels better. Same with the shoulder. So think of bursitis as swelling, and you got to get your shoulder above your heart. The only way to do that is to have a fairly upright torso, which means you've got to sleep not flat, a little bit propped up, like in a lazy boy or a recliner or some pillows. And most people, through trial and error alone, even if they don't know anything about the shoulder, just the desperate search for pain relief at night will eventually discover that when they're propped up in bed and put a little pillow here, put the elbow away from the side, better. And better is better. At least for that night, it's better. And the other reason why the shoulder hurts at night, which I think is important for people to understand, it's a source of confusion, is how the brain perceives pain. So the way the brain perceives pain is most interesting. It's called the gate theory of pain, and to take an enormous amount of understanding to distill it down to simple enough that I can understand it, is this. There's big nerve fibers and there's little nerve fibers that bring sensations to the brain. The little nerve fibers bring pain. The big nerve fibers bring most everything else. Temperature, vibration, position sense, stuff like that. And when you have big nerve fibers and little nerve fibers at the same time feeding the brain, for reasons unknown, well, there's a lot of speculation. So it is sort of known, but it's called the gate theory of pain. With big nerve fibers and little nerve fibers are both bringing sensation at the same time, the big nerve fibers win. So the brain gets easily distracted away from painful stimuli when other stuff is going on. During the day, you're doing stuff. At night, you strip away all the extra stuff. You strip away the distractions, and all you have is what little pulsations are coming from the little nerves, the pain nerves, and that's what bothers you at night. And it is common for people to say, patients tell me, I can live with if my shoulder just hurt during the day, I'd be fine. I wouldn't even seek an orthopedic surgeon for treatment or surgery. But what gets me is pain at night. And it's the same pain. It's just that during the day, that pain is being blocked and sidetracked by other stimuli. It's just sort of the way God made us. The way the brain is called the gate theory of pain. But the brain gets distracted from pain when other distractions are available. The value of getting a consultation when your shoulder hurts is so at least you can make an informed decision as to what to do next. Understand what's your diagnosis, understand what the treatment options are, and is the considerations of treatment worth the consideration? for you and for you alone. So lastly, let's go to the why. So we've talked about the what, the diagnosis, what's the problem, how to get it better, the stretching, the strengthening, and in some cases the surgery, improving the anatomy. But why? Why do you want it better? Well, to me, the secret to the happy shoulder is finding the motivation to do the daily grind of shoulder work. Much because the shoulder degenerates as you get older. It's a constantly changing thing. And it's not like you break a bone and it hurts and it might need treatment or a cast or surgery, and then once the bone is healed, forget about it. The bone's healed, move on with your life. Not the shoulder. So the shoulder is something that you might be psyched and motivated and inspired to deal with this thing for a period of time. Then after a couple, 3 months, once things are going reasonably well, you know, and you say, okay, I'm ready. I'm glad that's behind me. I'm ready to move on to something else. Over a period of time, the shoulder pain creeps back in. You have to sustain good habits. It's very analogous to low back pain. For those of you who've had low back pain and you successfully managed to control it, you recognize that every day you have to remind yourself to control it. You've got to remind yourself. It's not like, oh, it's better, now it's gone. It's not gone. It's just controlled. So I think the secret of the happy shoulder, you know, to me, one of the truisms, does not just apply to the shoulder, it applies to everything, that keeping active is the key to staying active. You need to be active. The great secret to successful aging is you've got to stay active. You've got to stay moving. And if stuff hurts, then you've got to figure out a way around it, or through it, or improve it, or do something with it. Because you got to stay moving. You got to stay moving. And making good informed decisions are obviously important, but the reality is, and I'm sure everyone realizes this, I deal with it regularly from the physician end of this, is that the decision that one person makes and their goals of what they want their shoulder to do are very different than another person. I may have two people who have a structural tendon tear in their shoulder with a bone spur. And one person wants to play tennis, which is going to be an enormously challenging thing to achieve. It's doable, but tough. Another person, they just have some discomfort when they garden. And so one person might need surgery. One person might be easily treatable without surgery, and yet they have the same problem. Their goals are different. So much of it is, what are your goals? State your goals. And if your goals are that lofty, good for you. But then understand, okay, you want to play tennis? Okay, that's great. Let's go for it. Now here's what it means to you. You know, you're going to do, you know, A, B, C, D, and E. And at some point you may say, geez, you know, maybe I'll play golf instead. So everyone makes their own decisions, which is best. I mean that's the central foundational truth of American all medicine. Is that, you know, the patient, everyone makes their own informed decision, and the informed patient, the informed citizen, is better for it. The reward of making the good decisions and achieving a shoulder that more is in line with what you hope it could do or you want it to do is that healthy bodies have healthy shoulders. It's remarkable to me how limiting it is for people whose shoulders don't behave the way they want them to behave. The shoulder is central to doing most things, not everything. You can certainly walk. You know, you can certainly ride a stationary bike. You can do a number of things. But the shoulder, you know, central to much of what we do is using the hand, taking advantage of the prehensile thumb, you know, positioning the arm in space, and then the shoulder is needful to do that. And if the shoulder can't do that, it's hard to gauge in activities successfully or durably with a shoulder that is that limiting. And if you find yourself being that limited, it may be that your activities get limited, and then this cascade of things start to emerge. I have two summary slides here, and then we're going to open up for questions. First slide. is that in the shoulder, function follows form. Now this is a juxtaposition of the architectural, term of form follows function. So in the shoulder, the anatomy, or the shoulder will generally take you as far as its anatomy allows, which means shoulders that don't have tendon tears do better than shoulders that do have tendon tears, generally. Shoulders that have small spurs do better than shoulders that have bigger spurs, and so on and so forth. But there's so many variables in play, and there's innumerable variables. It's variables of the human condition, variables including genetics. Much of spurring and shoulder generation is linked to genes. Some people just degenerate earlier, or more substantially than others, absent other considerations. Wear and tear accumulation. What's been your lifelong habit? Active, not active, sport play. You're someone who in their 20s and 30s were rambunctious and did all these things on the weekends and crazy, and now in your 60s, your shoulder's paying for it. Have you had a physical job your whole life or not a physical job your whole life? Those things add up. Not day to day, not week to week, maybe not month to month, but year to year. Pain tolerance. It's remarkable. Some people can deal with things easier than other people. That's just the variability of the human condition. Another variable is the efficacy of simple remedies. It's amazing how some people can have discomfort for certain activities. They take an Aleve, they take an ibuprofen, they rest for a day, shoulder's fine. And other people, it is not that simple. And it's not that they have a worse problem or a more significant problem. It's just for some reason, simple remedies don't work in all people. In the meantime, when that happens, I say, God, it's too bad. Life is so simple if simple stuff works. So to me, the secret to a happy shoulder is really getting down to the clarity as to why it's important to seek a shoulder that doesn't hurt. Why do you want a shoulder that functions better? I mean, without question, you have to understand and have the intellectual understanding of what's the problem, what's hurting, what's the diagnosis. That might be straightforward. Maybe you've gone to a therapist or a physician or somebody and you figure it out. So at least you know what is the problem. Certainly, you have to understand the how to get it better. You have to understand the mechanics. How do you stretch it? What's the best way to stretch it? How do you strengthen it? You have to understand the concepts and be somewhat facile, with how to do them, especially on your own. But ultimately, what it comes down to is doing it. Is the clarity of why. Why is important? As they say, why is the source of what inspires people to act. By getting a shoulder that you can make more functional. I mean, sometimes shoulders, as shoulders degenerate in age, you're not going to make them pain-free. I mean, they got spurs, they got bursitis, they got things in them, and you can't avoid that. But you can get them better, and you can get them better to a point that a little bit of sensible approach, a little bit of activity moderation, occasional use of anti-inflammatory medicines, and the summation of those efforts allows you to have a shoulder that doesn't limit you. To have a shoulder in which the choices of what you do are not so much based on what your shoulder says you can do, but what you want to do. And to me, that's a good shoulder. Or, according to my talk, that's a happy shoulder. Thank you.